hospital has both from the side of the university and also from the side of the ministry. You find that we have an average admission of 600 patients per night. We are overstretched. However, all in all, we continue to specialized services in this region are accessed from this hospital. This is the Ministry of Health. I want to appreciate the Ministry of Health because we have two functioning we have one these injuries, and commonly women get them during deliveries, and eventually you find that these unfortunate of ours, urine starts coming out through the non-proper route where the urine normally passes. It is a disgusting and a disturbing condition. I'm extremely happy to our gynecologists who have made it actually a must that every year they run 2 to 3 camps here at Mbarara Regional Referral Hospitals. But again, with the support of Ministry of Health and other implementing partners, they have extended this service to other areas, including in Akaseke, I think, Ibanda, and the other areas. This camp has attracted very many clients or patients from different corners of this country. And a team led by our fistula surgeon, Dr. Musa Kayondo, has managed to work on all of them. I think the last patient is being worked on now, and they wind up the whole program. I'm happy that the team has been consistent. A year in, year out, they try to organize and make around 2 to 3 camps in a year. This is done deliberately such that they access, all these patients access a free service. This fistula repair has been free all through, irrespective of where the team goes. They have tried to come so close to the patients. That's why they stretch up to the north, up to the center, then the far west part of this country. They want to reach the patients where they are stationed. And eventually, the real final camps take place here at Mbarara Regional Referral Hospital. We've worked on serial numbers. The statistics are very big. I don't want to go into those details, But this is a free service that every individual can access at any time you want it from Mbarara Regional Referral Hospital. The team is always waiting to give a help to these patients. The camps just come occasionally. That is when we go on the radio and we reach to the opinion leaders, we go to the church and the TVs to make sure that whoever has this condition and is not aware that we are doing this procedure here comes to get it, and every time they come, they really get services. I'm very happy for that team. I'm really happy for the Ministry of Health for your dedicated efforts and guided really energy to make sure that Ugandans access the service. Patient care, the patient safety, this is a mandate of this hospital. It is provided to whoever walks in for the service. But in particular, the fistula patients, yes, you say that it brings hope. That is very true. I don't know whether you have an imagination of having a sister or a wife who is leaking urine all the time. I want you to get an imagination of what they go through. A person gives the first birth, gets birth injury, and the urine since then starts leaking. This will automatically stop you from joining the social circles. Most likely, you will never go again, you will never attend most of the parties. That denies you a chance to associate with your friends. You may not comfortably even go to the church. You can't go to marketplaces. You can't even visit your own child at school. So you end up actually getting confined in one place. And it becomes worse when you go deep inside. You find the urine, of course, it comes with a stench that over the time it needs a meticulous cleaning and all the time. So it is a bothering condition. Every time these fistula surgeons, they successfully repair a fistula, and the mother eventually goes and finds herself comfortably joining the social circles, having a very neat bedroom and the rest. It is a good hope that comes to every individual.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk Show.
Winning requires the stamina of a lion. But most importantly, it requires that you carry that water up the top of the hill. However, you must use a spoon. Take the water now. Go, run, climb up the hill in 72 spoons. Faster, go, go. Winning is hard, but with MTN Momo, it's easy. Simply pay or shop with Momo for a chance to win mobile money every day. Use the Momo app or dial *165*3#.
It's true what people say, that when I wash and you wash your hands with soap, we'll have less infections as Ugandans. After all, it's hands that handle money. It's hands that feed us. Hands that prepare soil for farming. Hands that we use to learn. And hands that we use for fun.
When I wash and you wash, it means clean hands for all. So, wash your hands with soap and clean water regularly to keep away infections and disease-causing germs. This message is from the National Hand Washing Secretariat with support from UNICEF.
Brand Ambassadors 256 presents the Getter Got Talent Star Search. Amanyika Talanta, the impact of talent. In the heart of our cities, where life is raw, real, and unfiltered, there lies an ocean of untapped potential just wanting to be discovered. Welcome to the Stage of Dreamers, a platform for the hidden stars. Your moment is now. Uncover extraordinary talent that lives within you. This is the time to live live your dream. Kakati kuba kafoto ngoli ku stage ya kabi. Never superstar ba kabi. Mu vibe za kabi. Kwali na bidi. Esukuma akabadi ko paka ku top. So, Olinzechi, grab your phone, get creative, and record a 3-minute video of you or your team Olabisemu ku talanta yo. Send it to 0759 958 138 or send it to connect@GhettoGotTalent.com. This is GGT, where talent knows no boundaries. Ghetto Got Talent, Amani Got Talanta. Visit www.GhettoGotTalent.com.
Talent in the ghetto is possible. Ghetto's got talent.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
So we're here doing at Mbarara Regional Referral Hospital, Mbarara University, Department of Obstetrics and Gynecology. We are doing a 1-week camp to operate women with fistula. Fistula is a condition where a mother after delivery starts leaking urine or stool, or in a very unfortunate ones, both of them. This is a condition which comes when the mother gets what we call obstructed labor for long, where the baby gets trapped in the birth canal and causes lots of damage there because of being stuck for long periods of time. It's a condition which usually occurs in very young mothers, those who get pregnant at a very early age, teenage pregnancies, and even those who have very narrow pelvises, much as they may be old enough, and those who do not attend antenatal care, and those usually who do not deliver from health facilities. Because when you're in a health facility, we can know if the labor is not progressing well, then we do an intervention like a cesarean section or help you in any other way. So it is condition of obstetric fistula. Most of the times when the mother takes long, the baby dies, and on top of the baby dying after delivering a stillbirth, they start leaking urine and start taking stool. Most of these mothers are very unfortunate in that they lose their partners because no partner wants to be with someone who is smelling of urine or smelling of stool. They are rejected by the society. They go into isolation and depression. We have seen some who have even committed suicide because of this condition. This condition puts women more into poverty because they cannot work. They cannot work anywhere. So that adds on to their depressive and emotional symptoms.
So how we prepare our patients, the preparation starts on wards, whereby patients come and they are screened and then sorted according to the indications they present with. Then they are distributed on different operating days. So, for example, today we are working on fistulas, patients who are leaking urine, and from the ward, of course, they are counseled and they are told about what is going to be done in theater. They are told about the implications they could get after. They make sure the procedure which is going to be done on them is understood by the patient, and then they obtain the consent from them. So before they come here, they must consent for the surgery that is going to take place. So from the ward, when they reach in theater, they are triaged according to age, whereby young babies are considered first and then elderly, and then those patients who have chronic diseases like diabetes and hypertension. So we first look at that. Then after that, they are brought in the operating rooms for surgery, whereby we start off from the preparation of surgery.
I'm called Birungi Paula. I'm a nursing officer working with Mbarara Regional Referral Hospital. Then I trained in VVF management and care. I also did counseling in the VVF. Then I'm working in the operating room. My roles are to prepare theater for the operations. I have to make sure sterility is observed. And during surgery, we have to make sure all the operating rooms, they are prepared before the surgery begins with sterile equipment. We have to make sure theater is very clean and tidy to prevent infections to patients, that is for infection prevention and control. And during the operation, we keep on counseling the patient as the operation is going on, because again, it is a new environment, in other words. Because the patient has come in the operating room, we see different people putting on masks, covering their heads, so the patient may be scared that maybe is in a wrong place or what. So we have to continue reassuring the patient. In most of the cases, they are being worked on under spinal anesthesia. Spinal anesthesia, it is giving a small injection at the patient's back. Is only from the umbilicus downwards, which gets paralyzed, but then the patient remains very conscious. So we have to keep the patient well informed of the surrounding, and we also have to introduce ourselves to the patient so the patient gets more comfortable with the team is working with. Then after the surgery, we clear off everything we have used in the operating room during the operations. We take the patient to the recovery room as we continue talking to the patient or reassuring the patient.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk Show.
Tuliko ground, Plascon, paint and win. Yes, yeah, Plascon, paint and win. Tuliko ground, Chicho, buy paint worth 100K. Get a scratch card, SMS the code to 7197. Stand a chance to win instant airtime, 1 million shillings bully day there, or a share of a 3 million shillings jackpot each week. What do you want the brand new Bodas, tuk-tuks, and so much more. Catch the paint and win action every Monday on Bukede One, NBS, and Sanyuka TV. Plascon, color your world.
Amazina ganje Niyetekwa Seruhanga John Bosco ninduga mu district ya Rukungiri, ndio muhanguzi wa miliyoni 18 na Uganda National Rotary. Nzahangwire urwo mu kuzana star 278 hash ngafuna message eriko ndio muhanguzi nashemererwa konka nabaza kugira ngo nebiya bafere sente ziriyo zona bakaziteka ngo nazihangwire.
Uganda National Lottery. Dream, play, win. Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Ituba Uganda and regulated by the National Lotteries and Gaming Regulatory Board. The Ministry of Health informs the general public that there are some cases of Mpox detected in Uganda. The ministry, working with partners and affected district local governments, are doing their best to contain the situation. The signs and symptoms of Mpox are body rash, fever, general body weakness, headache, sore throat, nasal congestion or cough, and swollen lymph nodes.
You can prevent yourself from getting infected with Mpox by avoiding close contact with people who have been confirmed to have Mpox or who have signs and symptoms of Mpox. Avoiding touching or sharing personal items like beddings, eating utensils, phones, or other belongings of a person who has the signs and symptoms of Mpox. Avoiding contact, including eating, with all wild animals, alive or dead, especially those known to carry the virus, such as rodents and monkeys, and those that appear sick or have been found dead. Getting vaccinated if you're among those who have been identified to be at high risk of Mpox infection. Mpox is treatable and usually goes away after 2 to 4 weeks. However, it can be severe, causing even death, especially among children, pregnant women, and those with other health conditions. For more information and support, contact your nearest health worker. Call the Ministry of Health's toll-free line on 0800 100 066 or send a free SMS to YouReport on 8500.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
We have got trained nurses to care for these sisters and mothers. We have got a very big team. The doctor I talked of, Dr. Musa Kayondo, has managed, plus his colleagues, they have managed to build up a very, very vibrant potential team. They have got skills, they have got the knowledge. Then we've got actually the theaters. We usually do it intentionally to create enough space when these patients are coming, because we don't want them to wait for so long. So this hospital has 9 operating theaters. So every time we have a fistula camp and we are lucky patients come in big numbers, we make internal arrangements. We secure enough space for them such that there is minimal waiting time. They come and access these theaters. They get worked on by the specialized team. And the same time when they go back to the wards, yes, they need a special care, especially for these repairs to take. If you don't take appropriate nursing care, these beautiful repairs that will have been done by these surgeons can easily really break down. So we have a team of midwives and nurses who have trained. They receive these patients right away from theater. They take care of them up to the last minute. When a full team does a ward round, they get satisfied and they discharge these clients, of course, with appropriate information of when should they come back, what should they observe, and so on. And we plan in a such way that they have to get their drugs in time and they get discharged with appropriate time. It is something we plan in advance such that when they come, they really go home back with a full hope. We want them to go back when they are changed people, totally different from the misery they have been living in. The truth is we have the fistula surgeons in this country, but they are overstretched, as you've heard. And maybe I want to inform you that this is a service that is offered beyond Mbarara. Our surgeons have their colleagues stationed in other health units who are helping them. Every time the mother comes to attend to the antenatal care, is given that advice, irrespective of the health unit you are at. If you come to the regional referral hospital, you will be told about the service. If you come to a health center for a general hospital, you will be told, because the health workers have shared this information. They have shared it with the midwives who receive our pregnant mothers when they come for antenatal care. So they are told of this service, when is it available, when is it offered, and so on. So we sensitize these matters well in advance, but at the same time, we've got that capacity building. This hospital has got a program. They keep on picking actually medical officers who are stationed at the lower health units, especially health center force, they come here for refresher courses. We have some support for them. They come here for around 3 months. They work together with our skilled fistula surgeons. After that time, they go back. When they go back, they disseminate this information to their colleagues. At the same time, they have the capacity to screen. They detect these conditions early enough and use the same chance to refer them. So the referring system is it is so designed in such a way that when a fistula patient is coming from a lower center heading to regional referral hospital here, the fistula surgeons are already aware. You find that they are waiting for you. When they receive you, they take you through the necessary investigations, and possibly there and then you get admitted. They plan to work on you. They work in a such way that they cannot allow piling patients. They prefer to work on you as you come in. Probably you find that maybe you come, they assess you, and they find that you have other issues that stop you from having an operation. They first rectify that. Maybe you come, you have a fistula, but you have uncontrolled sugars, you have poorly controlled high blood pressures, or you have local infections there. Conditions will never disappear up to 0 level. They just reduce enough. I'm not a gynecologist, but of course I have an idea.
There must be certain conditions in place. Is it true that you pay 5 million shillings to MPs at
From the blues to the streets of Africa.